Behavioral development. Behavioral theories suggest that personality is a result of interaction between the individual and the environment. Behavioral theorists study observable and measurable behaviors, rejecting theories that take internal thoughts and feelings into account. These theories represent the systematic application of principles of learning to the analysis and treatment of behaviors. Behaviors determine feelings. Thus, changing behaviors will also change or eliminate undesired feelings. The goal is to modify behavior. The focus is on observable behavior, a target symptom, a problem behavior, or an environmental condition, rather than on the personality of a client. There are two fundamental classes of behavior, respondent and operant. 1. Respondent, involuntary behavior, anxiety, sexual response, that is automatically elicited by certain behavior. A stimulus elicits a response. 2. Operant, voluntary behavior, walking, talking, that is controlled by its consequences in the environment. Best known applications of behavior modification are sexual dysfunctions, phobic disorders, compulsive behaviors, i.e., overeating, smoking, and training of persons with intellectual disabilities and/or Autism Spectrum Disorder. It is impractical for those using behavior modification to observe behavior when clients are not in residential inpatient settings offering 24-hour care. Thus, social workers train clients to observe and monitor their own behaviors. For example, clients can monitor their food intake or how many cigarettes they smoke. Client self-monitoring has advantages, i.e., inexpensive, practical, and therapeutic, and disadvantages, i.e., clients can collect inadequate and inaccurate information or can resist collecting any at all. There are several behavioral paradigms. A respondent or classical conditioning, Pavlov, learning occurs as a result of pairing previously neutral, conditioned, stimulus with an unconditioned, involuntary, stimulus so that the conditioned stimulus eventually elicits the response normally elicited by the unconditioned stimulus. Unconditioned stimulus, unconditioned response. Unconditioned stimulus plus conditioned stimulus, unconditioned response. Conditioned stimulus, conditioned response. The operant conditioning, B. F. Skinner, antecedent events or stimuli precede behaviors, which, in turn, are followed by consequences. Consequences that increase the occurrence of the behavior are referred to as reinforcing consequences. Consequences that decrease the occurrence of the behavior are referred to as punishing consequences. Reinforcement aims to increase behavior frequency, whereas punishment aims to decrease it. Antecedent response / behavior consequence. Operant techniques. 1. Positive reinforcement increases probability that behavior will occur, praising, giving tokens, or otherwise rewarding positive behavior. 2. Negative reinforcement, behavior increases because a negative, aversive, stimulus is removed, i.e., remove shock. 3. Positive punishment, presentation of undesirable stimulus following a behavior for the purpose of decreasing or eliminating that behavior, i.e., hitting, shocking. 4. Negative punishment, removal of a desirable stimulus following a behavior for the purpose of decreasing or eliminating that behavior, i.e., removing something positive, such as a token or dessert. Specific behavioral terms. 1. Aversion therapy, any treatment aimed at reducing the attractiveness of a stimulus or a behavior by repeated pairing of it with an aversive stimulus. An example of this is treating alcoholism with antabuse. 2. Biofeedback, behavior training program that teaches a person how to control certain functions such as heart rate, blood pressure, temperature, and muscular tension. Biofeedback is often used for attention deficit / hyperactivity disorder, ADHD, and anxiety disorders. 3. Extinction, withholding a reinforcer that normally follows a behavior. Behavior that fails to produce reinforcement will eventually cease. 4. Flooding, a treatment procedure in which a client's anxiety is extinguished by prolonged real or imagined exposure to high-intensity feared stimuli. 5. In vivo desensitization, pairing and movement through a hierarchy of anxiety, from least to most anxiety-provoking situations, takes place in real setting. 6. Modeling, method of instruction that involves an individual, the model, demonstrating the behavior to be acquired by a client. 7. Rational emotive therapy, RET, a cognitively oriented therapy in which a social worker seeks to change a client's irrational beliefs by argument, persuasion, and rational reevaluation, and by teaching a client to counter self-defeating thinking with new, non-distressing self-statements. 8. Shaping, method used to train a new behavior by prompting and reinforcing successive approximations of the desired behavior. 9. Systematic desensitization, an anxiety-inhibiting response cannot occur at the same time as the anxiety response. Anxiety-producing stimulus is paired with relaxation-producing response so that eventually an anxiety-producing stimulus produces a relaxation response. At each step, a client's reaction of fear or dread is overcome by pleasant feelings engendered as the new behavior is reinforced by receiving a reward. The reward could be a compliment, a gift, or relaxation. 10. Time out, removal of something desirable, negative punishment technique. 11. Token economy, a client receives tokens as reinforcement for performing specified behaviors. The tokens function as currency within the environment and can be exchanged for desired goods, services, or privileges.